The AACR Conference on the Science of Health Disparities is, I think, a very important conference. We have issues in the field really that relate to access to care, but really also cultural differences in access to care. This is one place to go to understand more about disparities and understand more about how we can shape the world and remedy disparities.
Our meeting, we're going to focus on some of the major cancer disparities, some of the solid tumor disparities and the blood disorder disparities. We're also going to have some really good sessions dealing with how one engages the community and how best to address some of the issues as it relates to cancer education in the community. Some of the exciting science is going to be revealed as it relates to precision medicine and how we can make this next step or this era of precision medicine more equitable across all populations.
I think it's very important for us to recognize that disparity, while the overall cure rates of cancer have improved over the past 40, 50-something years, thanks to scientific discovery and clinical research, but the racial disparity remains as a very substantial issue for the cancer community. I think now in the age of precision medicine, cancer moonshots, the opportunities are probably ripe for us to make substantial advances to understand the biological basis of racial disparity, to see how we can use that to guide precision medicine and to eliminate the racial disparity, close the racial gap in many different cancers.
This meeting actually is an extremely broad and rather eclectic meeting because it crosses many dimensions of research and healthcare. We have basic scientists who are into genomics. We have basic scientists who do a lot of cell and molecular work. We have population-based scientists. We have behavioral folks who measure the environment, all together in one meeting with one mission to discuss the science of disparities. And you're not really going to find that often. And it allows folks to be quite interdisciplinary. And I think that's one of the exciting aspects of this meeting.
Racial disparity is a very complex issue, if you will. There is socioeconomic factors, there are biological factors, environmental factors. So by virtue of that, every time when we organize this conference, it's very exciting, but also very challenging because you have to bring people from very diverse backgrounds and very different disciplines together to talk about this essential issue of a disparity. So I think there are breakthroughs and very exciting findings from all aspects of those. I mean, people are looking at, for example, minority enrollment in clinical trial. What do we have learned in terms of patient behavior and navigation? How can we use that to implement in clinical practice to improve the enrollment and how that will benefit the minority population and reduce the disparity?
As it relates to cancer disparities, I think the AACR has really taken the bull by its horns and has established a consistent group of investigators who come and new investigators every year to discuss this issue. This is about the science of cancer disparities. So this is basic clinical community population science folk who are coming together and saying, look, there's some science behind this, and it is useful for us to come together and do this. So AACR has been leading the field in that.
I think for young investigators, it's a good place to look at the entire spectrum of opportunities that might be out there for them. The key thing is being able to collaborate with individuals, be able to hear from the world's experts in these areas and help them guide their own thoughts about where they might want to go.
Disparities research and the science of disparities is a relatively young field. A lot of it is going to be driven over the next decade by the younger folk. So bringing them together, getting them excited, keeping them excited about this area, and then also allowing them to network with other investigators is useful.
This conference in particular is nice because it's still of a scale, as much as people I'm sure would like to scale it up. It's of a scale that creates an intimacy, a chance to really have face-to-face time with the folks who are the leaders and the folks who want to learn how to do these things. So all the trainees to the leaders, it's a much shorter path.